name is Dan Twitu, and I'm the CEO of NeuroQuest. This is my grandfather, Saba Moshe, Grandfather Moshe. That's me over there, hugging him with lots of hair. That was many years ago. Saba Moshe was born in Romania at the turn of the century. And I remember his stories about living in a small town at the turn of the century. We had a very strong bond. He was a very dear member of our family. His last few years were very, very hard on him, and on us, the family as well. Saba Moshe suffered from Alzheimer. This is why I'm so proud to be part of the international effort to defeat this horrible disease with a cutting-edge technology. Some of you may know someone that suffers from Alzheimer. My personal story is the story of many, many others. Look at these numbers. The social and human impact are enormous. This is because mainly the treatment for Alzheimer patients falls on the family. These figures are projected to increase dramatically over the next 10 years because of the aging population. What if we could diagnose Alzheimer before symptoms appear? What if we could target the disease in its earliest stages, before irreversible brain damage occurs? This is where NeuroQuest comes into the picture. The science behind our technology has received a lot of international interest, with publication in the leading journals, Science and Nature, including one recent publication a week ago in Nature. We are harvesting 20 years of research by Professor Michal Schwartz from the Weizmann Institute. She has investigated the relationship of the peripheral immune system to brain injury and to neurodegenerative diseases. Based on her research, we've identified a set of immune cells in our peripheral blood system that correlate to the formation of plaques in our brain. These plaques, beta amyloid plaques, are correlated to development of Alzheimer. We know today that these plaques can be formed 10 to 15 years before symptoms of Alzheimer's appear. These plaques can be visualized using PET scans. But PET scans are not an accessible and viable tool for screening because they are very, very expensive. They involve the injection of a radioactive substance, and they require highly skilled personnel. We at NeuroQuest have developed a simple blood test that is affordable and can be used as an effective screening tool. Imagine, just like you go for a yearly cholesterol test to assess the risk of developing a heart condition, you would go for a yearly blood test to assess the formation of beta amyloid plaques in your brain as a risk factor for Alzheimer. We are a research-driven company. Look at these numbers. Those are our clinical trials. Following a successful clinical pilot here in Israel, we've joined the leading biomarker study in the world, the ABLE study in Australia. Interim data were very, very promising with very high sensitivity and specificity for our test. We have now completed additional 130 subjects and recently have signed an agreement with the University of California in San Diego for additional 700 subjects to be tested with a blood test. These samples will be collected from a study, the A4 study, that is sponsored by the NIH and Eli Lilly. So we are a very strongly result-driven company. When we look a little bit further to commercialization, we've developed a three-tiered approach. Early revenues are projected from a laboratory-developed test under a CLIA CLIA laboratory setting. This is a low regulatory barrier entry point for us. Later on, we speak about strategic research collaboration with companies that are developing drugs for Alzheimer. Today, research is focused on early treatment, and we see ourselves as a companion diagnostic to drug treatment. And later on, the sales of kit and for royalties from partnering once this test is available worldwide. I'm excited, and I hope I got you also excited with this technology. Just before I finish, I want to mention that sitting with us here are members of the business delegation from South Carolina. We are part of South Carolina business community. Our investors have come from there, and we've opened a subsidiary there. So thank you for being supportive for us. If you'd like to hear more about our technology, please come and meet me after the presentation. Thank you very much.
How do you envision the information coming out of this test being used by both patients and their caregivers?
That's a very good question. And in other words, the question is, okay, so what do we need that if there is no drug today, and what's going to happen with this test? So I need to emphasize that the entire research today in Alzheimer, that seek for drug, is focused on early diagnosis. It is understood today that treating people that show cognitive decline already is way too late. This is irreversible brain damage, and there's nothing you could do. So drug companies like Eli Lilly and Biogen and many others are trying to develop drugs to treat before there are any external symptoms. And for that, you need good diagnostic tools. I mentioned PET, but PET is not inaccessible, and there is a great need for a simple test, a blood test preferably, or some kind of non-invasive test to indicate the formation of the disease. We assume that those companies, some of them are already in phase 3, will develop the drug, and you need a simple test. Today, when there is no drug, there's still many things that you could do, and these are very, very important. You can do some brain exercise, physical exercise, nutrition, prepare yourself. There are many, many things that you could do. But we see ourselves in 3-5 years from now with a drug for Alzheimer and the necessity of a good screening tool.